If you joined us over the last few semesters, you know how this is going to go. If this is your first time joining us, we want to welcome you. I'm going to give you a couple of logistics and housekeeping things just so that we have an opportunity to keep the evening rolling. So with a couple of things, we will do about 30 minutes of a presentation from our speaker, and then the last 30 minutes will be Q&A for you guys to ask questions. Since we are in a webinar setting, we cannot see you, but you will have an opportunity to submit your questions either through the chat, the Q&A, or you can raise your hand. So if you hover down at the bottom of your Zoom bar, you'll be able to see all three of those options. As throughout the presentation, you can submit your questions, or you can wait until we get into Q&A. But once you submit those questions, we will pull you over and ask you to unmute so that you can ask your question directly to our presenter, and then we'll send you back to the attendee list. If you are here as part of credit for an academy or a class, we do not have any of the paperwork that you need to have signed and filled out, nor do you need to send your one-pager to us. That needs to go to the teacher or the headmaster that gave you the details on this presentation. So I know that we've lost our presenter again, so hopefully we can get her back, but those are the logistics for this evening. Monica, do you want me to turn it over to Jeff so that he can read her bio? Okay, so I'm going to turn it over to Jeff Lavarchek, who is with Chevron Phillips Chemical Company, and he is the EfTA board chair this year. We welcomed him on as the board chair in September. So I'm going to turn it over to Jeff so that he can read the bio and introduce our speaker for this evening.
All right, thanks, Corinne. It's my pleasure to introduce Dr. Jimena Carmen Qadir. Dr. Carmen graduated from Tulane University in 2004 with a bachelor's degree in cell and molecular biology and a doctorate in philosophy degree in biomedical sciences. In 2014, she earned a Cancer Research Training Award fellowship with the National Institutes of Health, also known as NIH. During her NIH training in the field of epidemiology and genomics research, Dr. Qadir utilized healthcare quantitative research methods to measure the overall trends of oncological diseases across the nation. She worked with various cancer centers nationwide and helped create a live database for clinicians and scientists seeking advice on complex cancer treatments. Furthermore, she has experience in performing grant portfolio analyses and reported which areas of medicine the NIH had allocated their federal funds. These NIH projects were successfully published in 2017 and 2018. List of publications reference another section. She successfully completed her MBA from the George Washington University School of Business. In recent years, Dr. Qadir held numerous leadership positions in large healthcare systems and private organizations managing their research and clinical operations. She has tremendous experience managing and leading the research agenda set by the institution. In addition, she's a board certified coach and has coached and consulted healthcare leaders and academic centers in the areas of leadership development and diversity, equity, and inclusion. Dr. Qadir was accepted into Forbes Coaches Council, an invitation-only community for leading business and career coaches. She was vetted and selected by a review committee based on depth and diversity of her experience. Criteria for acceptance includes a track record of successfully impacting business growth metrics, as well as personal and professional achievements and honors. Dr. Qadir is a fellow and DEI board council member of the Institute of Coaching, McLean, which is an affiliate of the Harvard Medical School, an active member of the American Association for Physician Leadership, and an active member of American College of Healthcare Executives. She's been published in the American Journal of Pathology, the Journal of Cancer Education, Gastroenterology, Cancer Causes and Control, the Journal of Investigative Medicine, and others. She's also a peer journal publication reviewer for the American Journal of Epidemiology. With that, it is my pleasure to introduce to you Dr. Carmen Qadir.
Thank you. Hi, Jeff, can you hear me?
We can hear you now.
Yes, we can hear you.
Okay. Sorry. So anyways, there were some technical difficulties, but it's a pleasure to be here. I really do appreciate you being here with all of you and just being able to share a little bit about what I do. And I really appreciate that introduction. So this is a PowerPoint. I don't know if you guys can see it, if you can actually see it uploading.
It says that you started sharing, but we're not actually seeing the PowerPoint yet.
Okay, okay, just one moment, sorry. Let's see if it will, just one second. Okay, can you see it now or not yet?
Not yet, but I can also try it on this end, if that helps.
Okay, yes, if you can share, saying yes.
Okay, are you seeing it? And are you seeing just that?
Yes,
Or are you
I
seeing
am.
the whole thing?
Yeah. I'm definitely seeing it. So we can go ahead and skip over the background since Jeff already did such a great job doing that. But so, you know, just really brief, I am a clinical scientist by training. And what that means is I did get a PhD in cell and molecular biology at Tulane University. What was really interesting is that, you know, I really always wanted to be part of research and sort of, you know, investigate on a larger scale diseases. And so that was the beginning of my journey. And, you know, was able to become a fellow at the National Institute of Health in epidemiology and public health. And at that point, I think in my career, I was able to sort of interact in different projects with the cancer centers across the country. And it's sort of pushed me into different leadership positions after my training for hospital and healthcare systems. And what was fascinating is that, you know, for the first time, I was doing something completely different. I was not really investigating research per se. I was really managing people and just, you know, looking at overall, what were the needs of healthcare systems, you know, of organizations, operations, their financial, the money, you know, if they were successful or not. So, you know, this is a first slide that I wanted to share with you that's very interesting is in healthcare, as you see here, there's a number, so this shows you a number of all the hospitals in the United States from 1975 to 2019. And as you can actually see in this slide, that's a little bit of a reduction of a little bit over, you know, 1,000 hospitals has essentially closed in the last 4 decades alone. And and then of course, in the last couple of years, there's been a little bit of a hike, some pickup that has happened. But when we look at this data, you know, we're fascinated by wondering, so why is this? Why is it that the number of healthcare systems have shut down in the last several decades? And it matters significantly because, you know, when we start sort of dissecting and diving into it, you know, was it that there was some financial issues? Was it that, you know, maybe the leadership wasn't there? And maybe they weren't leading the organization in a way where people felt, you know, included, everyone had a voice sort of at the table with what was going on. Were there some, you know, maybe patient quality issues that sometimes can happen as well? So, or maybe, you know, it could have been some funding issues too, because healthcare systems, you know, do get a little bit of government funding as well. So in this particular picture, I just think it's so fascinating because, of course, you know, there's that decrease. And so it's worth for us to know. And the next slide, where it actually shows you the persons employed in United States hospitals from 2000 to 2021. This picture, I also think is even more telling because as you can tell, the numbers have increased. When you look at in the last 21 years, there's roughly about 2,000 more hospital employees than they were when we first started the 21st century. So when you kind of put this together, you know, it's interesting because the number of hospitals have decreased, but the number of employees has gone up. And that tells us a couple of things. One, you know, there might have been some problems with some of the hospital healthcare systems and why they closed, but the second thing is patient population and population growth in general will continue no matter what. And, you know, according to the United States Census for Bureaus, you know, had projected that as of January 1st of this year, they would be about roughly around 333 million Americans in the United States. So that represents, 0.21% increase in population. So my point is the population keeps increasing. And so the demand for healthcare is still there. And, and what we need to do, work in the healthcare systems is to ensure that we're delivering, again, good quality of care. We're being very efficient and effective in our roles, because as the population continues to boom and maybe we don't have enough facilities, how are we going to navigate that? One thing worth mentioning on the third slide is the average life expectancy for countries. And this was data, that was taken from Statista. So very good data. And it shows that the average life expectancy in these selected countries, for the United States, it's 77.3. Sorry, next slide, please. Okay, oh, thank you. So the life expectancy for both men and women, is at 77.3, meaning the majority of Americans will live to an average of 77 years old, which is pretty incredible. So this is an increase in the last century, we know, in the last 100 years, because we have so many different advanced levels of technologies and equipment. The way that we, see patients and that come through the emergency room, patients that eventually stay in the hospital, the way that we manage those patients is more efficient, is more effective. We're able to pinpoint diagnosis, why they're sick quicker than we would have, maybe 20, 40, even 100 years ago. And we're able to manage their illnesses pretty well. We have very advanced, like I said, technologies that can help us with diagnosis and treating patients. And that sort of has pushed a little bit and prolonged the life expectancy, on average. So if you notice, on this graph, the United States, again, being one of the leading healthcare systems in the world, has an average of 77.3. And then there's a good number of countries listed above us, obviously, that their average age is a little bit higher. But, I think that has a little bit to do maybe with their lifestyle modifications and diet and other things too. Americans, we have a very rich way of eating and our diet. And so that also is a contributing factor to all of this too. But I want you to keep in mind again, so we're seeing a decrease in hospitals. We're seeing an increase in the number of hospital employees, and the average age in the life expectancy of an individual, will live at least on average to about 77 years old. So next slide, please. This shows the total hospital expenses in the United States from 1946 to 2019. And I think actually this is a slide that stands out the most to me, is the cost. So even though our life expectancy keeps going up, with that, there's going to be more of an excessive cost, because we are investing money in medical technologies. We're investing money in drugs, medications that we think could, again, lengthen the life of individuals, such as cancer patients. We've come to understand what is known as precision medicine, what specifically is wrong with some of these patients. Where is a gene, for example, the cause of their cancer? And we're able to actually target that gene and turn off the cancer, so to speak. So an example in this setting is breast cancer. Women have had the opportunity to survive breast cancer more so now than they did in the 90s. So in us increasing our life expectancy and living longer, with that obviously comes cost. And, the cost has increased substantially, as you see in this graph. And, along with the investments that we give into a healthcare system, we also have to ask what else is part of this cost. why are we spending more millions of dollars a year in healthcare? And some of it too could be the way that we manage our healthcare system. So that's the part where, I kind of come in healthcare coaching and consulting, and I kind of, look at things overall from a organizational standpoint. Are we doing what we should be doing to lessen some of those unnecessary costs? So the last slide in terms of healthcare statistics is the next one. And this is about satisfaction in hospitals and during the pandemic, specifically when it started in 2020. And the United States in this particular graph is the gray line. And as you can tell, during that year, patient satisfaction kind of hung around, probably on average around 80%. Those folks that were living in the UK, they had a patient satisfaction level of greater than 85. And then individuals in Germany on an average were somewhere sitting around 75%. So patient satisfaction is actually a big deal when it comes to how healthcare systems, are assessing their quality of care and delivery to patients, meaning when the patient comes in through the door, are we diagnosing them correctly? Are we giving them the right treatment? And their length of hospital stay, right, is a big deal. It's a big sort of measurement that we use to ensure that patients are not staying in the hospital longer than they need to. And that could also be contributing again to the cost that you see that has gone up in healthcare systems as well. In fact, most of the hospitals, if not all of them, are in the United States are part of a hospital quality initiative with the United States Center for Medicare and Medicaid, which is, for the elderly and for the poor. And this is actually called the Hospital Outpatient Quality Reporting Program. And what it is that most hospitals, if not all of them, participate in it. And they report every year what their complications were, what their quality data was in terms of, in the hospital, did they have, what percentage of patients had trouble versus what percentage of patients, were successfully treated. So this is quality data that gets reported to the Center for Medicare and Medicaid Services. And it's sort of an incentive that CMS gives hospitals. If their quality data that they're reporting is really good, then they'll get an incentive. They'll get, the hospital will get incentivized for it. So, quality of care is a big deal, and it goes line in line with patient satisfaction. And so this is one of the biggest, I would say, measures of a metric that we use in the hospital systems to see that in fact our processes and our structure and our patient outcomes and how efficient we are as a team is working. So to now turn the page from healthcare statistics and where we currently are in 2022 to where someone like me comes in. So next slide, please. Coaching and consulting. So eventually through leadership positions that I held in major hospital healthcare systems in Southeast states, I started realizing that there were some parts of the healthcare systems that really needed coaching. And by default, I actually became an internal coach for some of the healthcare systems in some of the Southeast states. And so healthcare coaching, which many people don't know about, is the process, like it says here, that you help people focus, discover and clarify what they're, number one, where they are today, number two, where they would like to go, and number three, how are they going to get there? So just to give you an example, some leader in a healthcare organization, may realize that in one of their hospital units, the quality of care is not where it should be. Some patients may be getting infections, unnecessary infections. Team is working long hours. There's not a lot of good communication with staff. So one of the major tasks that healthcare leader has to deal with is, how do we turn the ship around? How do we get this particular unit to be more responsive and to deliver better quality of care? And so a healthcare coach like myself would actually, come in and I would work with this healthcare leader for a healthcare system, and we would work very closely in a partnership on how to develop, the necessary needs that the organization needs to pivot into. So like it says here, we would use focus type tools that can expand that leader's capability. There's maybe something that they're not seeing, but we can use certain tools to sort of enhance, what's going on. And again, coaching is a development experience, like it says here, and it's your ability to develop and work through your own solution. So a healthcare coach actually is not going to provide solutions for the healthcare leader. We will guide them to the solutions that they think they need to implement into their hospital. We use powerful skills of listening and asking very powerful questions to get them to arrive to the answer that they need. And the reason why coaching is like that is because, again, the healthcare leader is, has ownership of the healthcare system. Ownership, I mean, they're the ones that are there to actually, they're seeing the ins and outs, they know what's working, they know what's not working. And so they know the system better than anyone does. And so they need to arrive to a place where they can come with their own solutions. On the flip side, consulting is very different. That's when I come in and, for example, if there's a problem, and let's say, the fifth floor of the hospital keeps getting, just to give you an example, there's some patients maybe that may develop, for example, like a minor infection or something from some other IV line, or just something minor. We would come in and we would sort of tackle the problem directly. We would start trying to identify what steps in the workflow process is the problem. So again, it's a process in which the consultant's actually identifying tangible problems within the organization. And we sit with the executive and leadership team to identify solutions to the problem. In the graph that you see here, I basically summarize it. Coach, we influence the leader's behavior. We provide for them tools and steps for them to take action, and we do not control the outcome. In consulting, there's a direct problem, and in this particular situation, we are coming in as consultants to tackle the problem, and we're looking for solutions to the problems, and so we're kind of controlling the outcome. And to be very honest with you, I do both. I get hired as a healthcare coach and a healthcare consultant all the time. And I know you may be thinking of some questions when I'm done with this PowerPoint presentation, but yes, there are times when I can do both, but I will explain that later when that happens, when I actually can do healthcare coaching versus healthcare consultant. Next slide, please. So again, in healthcare consultant, we're identifying the best practices. We're collecting facts, like what is going on the fifth floor. We're defining the problem. What is actually the problem that we're seeing there? And we're helping management team kind of reach a conclusion to the problem that they're experiencing within the hospital system. And to be honest with you, we do recommend solutions on how they can better be more efficient and more effective in the process and to minimize some of the problems that they're having. So we're ensuring improvements and we're making sure that the changes are sustainable. But again, the changes are only sustainable to the current problem at hand, but it may not be long-term sustainability. And I'll explain that in a minute. Next slide. So this would be sort of an example of a healthcare consultant, right? Let's say a healthcare system is thinking, I really am interested in starting a digital health program. And most hospitals at this point do have one. Most of our rural hospitals and in small towns sometimes may not have a very established telehealth system. And so, the investment is also a lot of money, and you have to find the staffing to do it, and you have to train them. So it takes a lot. And in this particular example here, the first step is, so the hospital is interested in digital health, which is virtual visits. It's when you see a physician, on camera. For some of you and your family members, during the pandemic, you were able to see medical doctors on camera through virtual health visits. And so, the executives would tell me, this is very relevant for our business. And we would sort of, run a poll and see how relevant or not this is for them to have this type of program, in their healthcare system. And this is an example by McKinsey and Company. They actually did this polling not long ago. The second step is, identifying what would be the main purpose of you opening up this digital health. What would that do? And so, consultants could then further run more data and gather more reports on what the consensus would be. And is it that they're improving the well-being and health outcomes by patients even more because you're tapping into patients' homes, through a virtual program and they don't have to physically come into the hospital? What about keeping up with competition? We talk about this all the time. Maybe hospital A is offering virtual visits with the doctor on camera, but hospital B is not offering it yet. So there's competition there. Retaining customers in this case, would the patients go to hospital A versus B because of the fact that they can flow back and forth between seeing in-person visits versus virtual visits. So retaining those patients, right, is a big deal. And so this is kind of like a flow step of an example of what consultant would look like if a hospital system said to me, we're thinking about establishing virtual health visits. And then the third step, would be, what do you consider the main success factors for, establishing this digital health program? And of course, we would take another polling from staffing and community and what that would be. And so in a healthcare consultant role like this, again, we're gathering tangible data. And at the end of the day, we're going to, say one way or the other, if a healthcare system should invest money in starting this program, invest money in maybe training doctors that can do virtual visits on camera. You also have to factor in technology, right? That's another cost. You have to have the right equipment for doctors to get on the camera and see you virtually through the computer. So in healthcare consulting, again, there's something tangible that they want, and we're there to provide, walk through the process, collect the data, so to speak, and provide answers, should you not do this? So the next step, or the next slide, sorry. This slide is remarkable because now I'm going to pivot into a little bit into what coaching is, which is very different. This is a slide that was created by Melvin Smith. He's actually part of the Harvard Medical School Coaching and Leadership program. And I thought it was a fascinating slide because it summarizes a lot of what healthcare coaching is. So, healthcare leaders want to continue to enhance the quality of care to patients, like I was saying. They want to be able to ensure that the community has access to the best quality of care. They want to think of innovative ways to make their hospital systems amazing, such as the virtual health program that I just talked about. And so in healthcare coaching, when there's ideas, and this is now shifting to how it's different, we would sit with the healthcare leader and we would have them discuss what all of their shared vision is. What's their vision? Why would they want this virtual visit program to start at their hospital system? And then we would explore together what their current reality is. Strengths, do you have enough doctors, like I said? Gaps, do you maybe not have enough money for the technology to get the program started? So we would kind of brainstorm together, but again, I'm not providing them with any types of answers. This is totally driven by them. And we're just sort of helping solidify the thought process for them to enhance this program. The third step would be, what is their agenda then? What are some things that they can actually, start creating for learning, growth, and to implement this change, this new thing that they want. And then the last step, which is really called our first next step, is now what are you going to do? What are some action plans and action steps that you want to take in order to implement this program? And we would have the healthcare leaders actually do most of this work and list out what they think would be the first steps. for them to, start a virtual health program. So in healthcare coaching, I think, and I know that a lot of my colleagues feel the same, it's actually more rewarding because the ideas are actually coming from the healthcare leaders themselves, from the healthcare executives. They're driving this, and we're sort of partnering with them to enhance those ideas. Next slide, please. So, in coaching, and why I think it's an amazing field in general, especially within healthcare coaching, is because we sort of partner up with you and we ask you, what is your purpose? Can you help clarify your why behind what you're trying to do? This new goal that you have, please, in some words, share with me your purpose. And this goes for everything, knowing your purpose and why you show up every day to work, and why, being in that position that you're in is meaningful, is worth more than anything. Like it says here, what gives my personal work meaning? And, to a lot of executives, sometimes they're missing that part, their purpose. They know that they have competition with other healthcare systems. They may not have the same programs that other hospitals have. So they're kind of choosing different routes based on other, very valuable reasons. But in coaching and in healthcare coaching, we try to kind of narrow it a little bit more, make it a little bit tighter. What is the real purpose? What behind this? What would give this more significant meaning to the doctors that would do this? Would this make them feel like there's still continuity of care, meaning even when the patients can't come in on site, they're still connected through a camera. So finding the purpose, to some of these healthcare leaders is important. And then combining that purpose with the value system in the workplace, right? And David Rock actually came up with this model that's called SCARF, which I know sounds really funny. But, values in SCARF stands for status, certainty, autonomy, relatedness, and fairness. So status, am I valuable? So in your workplace, do you feel that you're valuable in the hospital system? Is your voice being heard? How are you ensuring that value is being transmitted in the workplace to others? Certainty, like it says here, I know where I stand or what will happen. So again, in implementing this virtual learning program, what would happen? What would be the certainty behind it in the future? What would that really do for your hospital system? Autonomy, you have a choice. So given the choice and not so much the competition that you see out there, is this something that you really want to drive, something that you really want to open up, to patients in the population? Relatedness, and like it says here, belonging, a sense of belonging, does the rest of the team actually agree that this is a right consensus for everyone? Does everyone relate with the decision-making process? And then fairness, are you being treated fairly in your decision? Is everyone else at the table being treated fairly in their decision that can impact patients or not? So defining purpose and value in healthcare coaching is important because we're kind of digging a little bit deeper. And we're trying to explore, really besides the tangible business competition and other things that are out there, what else? Is there a consensus within the organization that this actually will inspire everyone? It will make everyone feel very passionate about their work, which, by the way, is way more important than the business component of the day-to-day work. Is this exciting for you in this particular experience for you and for others? Next slide, please. So in healthcare coaching, there's themes for that, and there's 3 of them that we focus on. How are you leading others? How are you leading the organization? The virtual health visit was one of the examples there. And how are you leading yourself? So these are the topics that I mostly work on and themes that I work on with people in healthcare coaching. if they're in leadership positions, how to further develop their skill sets. Are they bringing others to the table? Like I said, in that SCARF model, are they including others to have a voice in the decision-making process? Healthcare worker coaching. This has been actually something that's been very important in the last, I would say, 2 years with the pandemic, because of just the burnout that a lot of people in healthcare have felt. So, just trying to find the most efficient ways to make things work, not because of business competition, not because of other reasons, but that works for the worker, so that the worker feels happy, fulfilled, in the healthcare system, and exploring ways, to keep their contentment and their sense of purpose and fulfillment, always intact. Same thing with physician developing coaching. Some of them sometimes have leadership positions, even though they're doctors, and they're running a whole unit, and they have other doctors under them and nurses under them. So what is their style like? If we opened up this virtual visit program, would you be able to manage your staff in a way that made them feel comfortable? That would put them at ease, that, you would respect their differences? And the rest of the list, again, team engagement, career transitioning. Some people during the pandemic have transitioned from one unit to the other unit. Some of them actually were just in a regular position, and now they're in a director or management position. So, so there's a transition going on. Interpersonal skills development. That's again, how you communicate with others. Are you engaged? Do you form teams in a way where everyone feels that they have some sense of belonging? Going back to that SCARF model. And again, managing teams remotely, which some of us have been doing since the pandemic, started in March 2020. Now things kind of have died down, but there's hybrid programs, and some teams, sometimes maybe 3 days at the hospital when they don't. And then when they don't have to see patients and they can do paperwork, they can do, 2 days at home. So how do you manage that? Are you a good leader that knows how to remain connected with those workers? Next slide, please. And so what we do in coaching is we set what's called SMART goals. We make sure that the leader that wants to implement this new change, this new technology like virtual visits, is actually setting a really good goal. I mean, is your goal specific? You want to target the population and help them see their physicians when they're not just in the hospital system. So it is specific. You want to target those patients when they're at home and that they're still receiving quality of care. Measurable, that's very important. What's the progress? So if we started this virtual visit, are you able to measure how successful the program is actually going in the community or not? Actionable, what are the steps you're going to take to start the virtual visit program? Are you setting, specific steps that you think would actually launch this off the floor? Is this realistic? Are you going to be overwhelming individuals? Do you have enough staffing? Do you have enough funding, enough bandwidth to run this on the side while full clinics are still being run? Time bound, when do you want to have these virtual visits, up and running? What's the deadline? Would you like to see these virtual clinic visits, started by December 1st? So having a deadline is important. And so when we coach healthcare leaders, we identify again their purpose and their values, but we also want to make sure that their goals are very specific, measurable. There's metrics that we can measure around their ideas. It's, there's actionable steps they're going to take. It's a very realistic goal, and there's a deadline to when they want to achieve this goal. No, we're not doing this in healthcare consultant, right? In healthcare consultant, again, I'm just going in and I'm doing this for them. So I find that it's less rewarding, is my point. Next slide. And I know I definitely want to wrap it up in a couple of minutes so that I can take your questions, but this is just an example of some coaching tools that I use. Again, these are what I would call behavioral change tools, because it allows the coachee to better recognize, what areas they need to work on while they're trying to implement, some of these new programs, as an example. But again, this is very applicable to other things too, not just implementing, a new program. It could be time management. Perhaps they're having time management issues. And so they would, again, hire a healthcare coach to come in and help them with that, identify where am I using my time? I'm here 10, 12 hours a day, and I just don't seem to be getting anything done. So this is a separate example from the virtual visit. But, so we work with different themes and different problems. But again, we're not coming up with solutions. We're having them arrive to their own solutions. But these are, to give you an example, some tools that I've used, having them learn to identify what's highly important. And for you guys, this is very applicable too. On Monday, what are some items, some tasks that you have to take care of that is highly important? What are some tasks that are still very important, but it's not urgent. You don't have to take care of it now. So that would fall under the neutral category. And then what are some tasks that, you just have to take care of, but it can wait. It doesn't have to be done today. And so we try to sort of change the habit and the behavior of the healthcare leader in a way that they're seeing their work and the tasks that they have to do every day in a different way, in different buckets. Highly important, neutral, meaning it is important, and then you have can wait. Some items that are just really not that important. They don't have to actually do it today. And then on the right side, there's this grid, and it's another tool that I use with healthcare leaders all the time, is similar to the prioritization sheet that you see on the left, is what's urgent. So, what's important and urgent. So major crisis, pressing problems, deadlines, meetings, projects. What are some things that you have to take care of now? Non-urgent, meaning, they're important, but it's not pressing. Some of this is prepping, planning for some meetings, for some big projects. So goal setting, so you have more time, but it's not really urgent. And then you have the not so important things at the bottom that can cause interruptions in the workplace and distractions. So again, these are two tools, coaching tools that I use with healthcare leaders that sort of helps them narrow down, what quadrant of their tasks should they be putting them in, and how important or not important is this, and should it be done, now, or can it wait? For the most part, the important, whether it's urgent or non-urgent items that they come up with, they will usually plug it into the highly important list of tasks that you see on the left. Some of them get trickled into the neutral part of their day, agenda. And then the non-important, those things that are kind of interruptions and distractions, they're able to plug it in and things that can wait. And sometimes they tell me, I've come to a realization that I can delegate, I can have someone else help me with that. So this is another example of time management in coaching, how to help a healthcare leader get more comfortable with time management. And so I just wanted to give you an example of these two popular tools that I use all the time. And again, I'm not, coming up with solutions for them. I'm just helping to drive their behavioral change, for them to sort of, see things from a different lens on how they could be operating more efficiently every day. And again, I'll say it again, that's what I think is very beautiful about coaching versus consulting. And then the next slide is, how do I, then measure how they're doing? And so I do have a program that it's called Coach Accountable, and most of my clients, healthcare leaders, have access to this. And we basically plot metrics meaning, data points on where they sit. And this is a real life example of an executive. On the left side, I had someone working on, what was important, highly important. What are some things that is important, but it's kind of neutral? And what are some things that can wait? And I had her change her behavior and how she was seeing her tasks. And as you can tell, from July of 2020 to January of 2021, she started really knocking out high task, highly important things by the end. When we first started the coaching partnership, she was only handling about, if you see here, the dots, like 5 tasks a day. And she was mixing some things that were important, not really that important. So she wasn't being as efficient with her time as she should have been. But as you see, as we're getting closer to January, she really starts picking up her tasks. She starts recognizing, these are the areas within my workspace in the hospital that I really need to be targeting. And she started targeting about, anywhere between 8 and 10 items a day. So really impressive to see. And this is, by the way, they entered this in, these data, how many highly task items did you achieve today? And I usually have them do it 3 times a week. So it's amazing when they actually see their progress and how much more efficient they've become. Surprisingly, not everything's always about work. So sometimes we also talk about other things that can impact their work, like self-care. One of the things she really wanted to do was do more self-care. How can she pick that up? Because as her level of activity, as you see on the left side, was going up, and she was knocking out tasks, and easily, and more of them a day, she also felt, like she needed some type of relaxation, some type of self-care, which is very important for healthcare leaders and workers. So we started plotting together, 3 times a week, between 1 hour and 2 hours, could you do something when you got home that had nothing to do with work and involve self-care? And as you can tell, she was able to pick up a lot of self-care items for her. She started exercising, meditating, she was getting to bed earlier. So things that really also enhance how much they're able to knock out during the day, right? If we're doing self-care things and we're not burnt out and we're doing enjoyable things, that also positively impacts how we perform at work. So the next slide is, and the last one is avoiding burnout. So when I coach them on tangible problems. But again, I'm kind of guiding them through behavioral change on how they're seeing their workspace, whether it's they want to start a new program, like the virtual visits, or they, have time management. I don't know how to knock out 5 to 10 things that are highly important a day. Can you help me identify what that looks like? And so I help them and I guide them through what that looks like for them, but they're identifying it, not me. And they're the ones that's driving those changes. And I'm sort of partnering with them, just seeing their progress. And again, this takes place through conversation. So we have coaching sessions. Typically they're about, an hour a week. It can be every week or it can be every other week when we're having these sessions together, these development sessions, I call it. And at the end of the day, what I'm trying to do in healthcare coaching is I am avoiding what is known as burnout, which is really big right now, especially, post-pandemic. We want to cultivate a connection mindset. We want to be very optimistic. We want to show healthcare workers and leaders to take care of themselves. We want to cultivate practices that produce contentment and avoid excitatory practices. We want them to get creative on how they may engage in activities with others. So, if you have an idea to start a virtual visit, how can you do that? Let's talk about it. Let's walk through it together. And other ways too, to avoid the burnout is, pause to be grateful, going for walks and exercise, more of the self-care, learning something new, setting aside time each day for a quiet period, never worrying alone. So having a team that can actually bounce ideas off of you. And of course, which I think is important, is serving others, which is what we do in hospital systems, is we serve others. And then the purpose again and value of that. So through healthcare coaching, we want to keep the healthcare workers and leaders in the left side, that burnout prevention category. And we, before they get burnt out, and then when that happens, we call that the burnout recovery, meaning, a lot of them start questioning, do I really even want to be in medicine anymore? Do I want to be in a leadership position? So coaching is important because we can prevent that from happening, and we can keep them in the burnout prevention side of things, if that makes any sense. So this is the end of my talk. And by the way, these are just 2 articles at the end. If you guys wanted to read, is the healthcare industry ready for coaching, which more than ever they are, and what healthcare coaching through crisis and trauma looks like. So thank you.
Thank you so much, Dr. Qadir. I'm going to go stop a share. I see that we have a student, so while I get situated to get him moved over, we always like to ask our speakers, what did you think you were going to do at 18? Like, what would you tell your 18-year-old self to get from where you are, from where you were to where you are now?
That's actually a very easy answer, and it's what I do in coaching. Is it goes back to your purpose, and I specifically put that in there for all of you guys listening tonight, because you really have to ask yourself what your purpose is. You know, what do you find most exciting, most valuable? And I think that I didn't ask myself that at the age 18, which is why I went ahead and got a PhD in clinical research, which I loved for that phase of my life. But if I really would have asked myself, what my purpose and my values were, it would have been to help, healthcare organizations, healthcare leaders, and healthcare workers make things easier for them, to coach them through processes that they're thinking of changing or thinking of starting.
Thank you. We have Marvin Stafford. Marvin, would you go ahead and ask your question?
I was wondering if it was hard to find work and for like companies and stuff as a healthcare coach. Sorry.
So that's actually a very good question. I will say that in the early 2000s, it was not that popular at all. And healthcare consultant has been the biggest drive, because a lot of time healthcare leaders, they have problems and they want you to come in and they want you to fix it, right? A lot of them have not wanted to invest time, is my point, into being coached, into looking at things differently. What are your priorities every day? What task are you taking care of first? And along with that, are you doing things to unwind after? Is there any self-care that comes with that? It's taken the healthcare industry such a long time, to your question, to understand that behavioral change and coaching within healthcare systems and focusing on personal development, like self-care and professional development, is a big deal. And so I would say 20 years ago, it was very difficult to find work around healthcare coaching. And now I would say that, the healthcare systems, it's about an 80% favorable towards healthcare coaching more than consultant, to be very honest with you, because healthcare coaching is more sustainable, because they're the ones that are changing themselves, right? They're the ones that are changing the system, and we're just kind of there to assist them in those changes in that process. We're not just handed some issue, we're fixing it, on the side away from them, and they don't even know how we're fixing it, and handing it back. So I think they've come to understand the value of healthcare coaching. And so now, yes, about 80% of the organizations have a very favorable view of it. And in fact, I have clients all over the country. I work with academic medical centers and healthcare systems nationwide.
Noah, you can go ahead and unmute and ask your question.
Hello, doctor. So I was just wondering, you were speaking of like self-care, but whenever I have free time, I find it really difficult to actually do like activities like self-care in the traditional sense. And I just like scroll on my phone, which really makes me feel worse. So.
Yes, it would make you feel worse. So, one thing I would say, and I find that this is very difficult for many people, is self-care. It's, for some reason, we're just so connected. And I encourage all of you guys to try to unplug just a little bit, because you're going to be very connected as you continue to get older, and eventually at one point you'll get to college, and then you'll be out in the workforce, like working. You're always going to be connecting. You're just going to really wish you had that time previously to unwind. Self-care is something that has nothing to do with your phone. It should be something that, that you really enjoy. It could be anything. That healthcare leader, that woman that I was working with, we started realizing that she liked to run, despite, her age, and she was in her late 40s, early 50s, but she was never a runner. And so she just picked up running. And she just really, in coaching, she made a point to be committed, is the point, to self-care. And so to your question, self-care requires commitment. And that's what I sort of teach individuals in healthcare, is to be committed, just the same way you're committed to patients and changing things in the healthcare system. Be committed to yourself too. Commit yourself to wanting to learn new things, to doing something different, to enhancing your overall well-being and happiness. I think that is way more important than anything else. If you can do that, then eventually you'll find your purpose, and eventually you'll find the value of what it is you want to do. But you have to, work on the self-care first. And I think once you do that, the rest will come.
Thank you so much. Erin, if you want to unmute, you're probably our last question here. We'll get you in right at the end here.
Did you realize you wanted to become a healthcare coach?
I'm sorry, when did I realize?
Yeah.
Yeah, sure. So that's actually a very funny question. It was when I was in healthcare leadership positions. I also was in healthcare leadership positions for a long time. And what I mean by healthcare leadership positions is director position. Those are all considered healthcare leadership positions, vice president position, the CEO, So all these positions I'm naming are considered healthcare leadership if you're in a management role, in a supervisor role. And I had those roles for years. And I started realizing that we were doing things in a consulting way, right? We were identifying problems, and then we were scrambling to see who had the answer and who could fix it. And what I really started realizing was that what was more valuable was to change the mindset of individuals, was to change our behavior in the way that we did things, was to look at our workflow process, like, which of these tasks are the most important that we should be knocking out first when we come to work. Again, which are the things that are neutral, like we definitely, want to keep our eyes on it and get it done by the end of the day, but it shouldn't come first. And then which are the things that can wait? So behavioral change and kind of reprogramming our mindset to how we look at things, I felt like just became much more valuable. And I, in fact, started doing it by default when I was in healthcare leadership positions. And I realized that it was actually more valuable than just fixing problems. I had happier staff, happier teams. People were performing much better. The way the work was getting done was much more efficient. Everyone was going home by 5. They were clocking in, clocking out on time. So I think once I started, learning the value of more of an indirect coaching to lead my teams, is when I started realizing I really want to do this. I would love to coach individuals in the healthcare space in general on how to change their mindset, how to be more productive, how to achieve their goals, but at the same time, how they can take care of themselves, because that's as important as the work also. So I would say it probably came to me, a little bit more than 10 years ago. And I went through the whole process. There's a process if you want to be a board certified coach. You take coursework. For several years, you have to coach a certain amount of individuals, and then you get a certification.
Very good. Well, students, we are at time. And so if you would join me, I know you can't speak, but if you would put in the chat your gratitude. Like I said, we have a lot of students that are interested in something medicine. They don't really know where to take that. And I think that's a wonderful way to enhance healthcare. But it's just kind of hopefully different than some of the things that are already on their list. And so I'm hoping that some of the students tonight had that chance to further explore. With that, I do want to thank Huntsman, our sponsor this evening. I thank Jeff, our board chair, for sharing a little bit of time as well. I know I do have a couple of students that wanted to do questions offline. And so I'm going to go ahead and stop the recording. Students, you are officially free to go. And like I said, I had 1 or 2 students that